Hello everyone. It's my honor to be here to give a presentation in the 29th International Conference on Software Engineering and Knowledge Engineering. My name is Zhiren Mao. I am from China. My topic is constructing drug ingredient interaction network to ensure medication security. If you ask why I do research on this topic, I'll show you that more than 50% patients use drugs in the wrong way, and a third of deaths in the world is attributed to the drug abuse and irrational use of drugs. Let's see. Drug is made up of effective components and auxiliary components. When two or more drugs are used together, effective components may cause changes of pesticide effect, which include synergistic effect, addictive effect, and antagonism. Reasonable drug interactions can enhance curative effect or reduce the adverse drug reaction, but the unreasonable drug interaction may reduce curative effect or increase toxicity. Here, this picture shows the overview of our work. Beforehand, we collect a large number of drug instructions from professional medicine websites. Then we do the pre-processing work. We pre-process these crude drug introductions into well-structured format. After that, we do the following work. We firstly recognize and extract the drug effective ingredient, and we then extract the drug's ingredient interactions from drug instructions. Next, we group and code these extracted drug ingredient interactions. The fourth step, we construct the drug ingredient interaction network, and the fifth step, we discover and infer adverse drug reactions based on the drug ingredient interaction network. At last, we generate a medical report in an easy way for users and patients. And for more details, here is a drug instruction that we quote from the website. We choose D, which includes DA, short for drug name, EC, short for effective components, and DA, short for non-drug interactions, as research data. The non-drug interactions DA often consists of more than one sentences. We first split DA into several sentences. The raw drug instruction should be converted into sentences. The attribute non-drug interaction DA is pre-processed into a list of sentences. For each DA, we get DA, which includes S subscript 1 till S subscript H. In this step, each drug instruction is pre-processed into a tuple D, which includes DA, EC, and DA. If a drug includes more than two effective ingredients, we will not be sure which effective ingredient is involved in long drug interactions. We filled out about 13,000 drug instructions without stating its effective ingredient or including more than two or more of the effective ingredient from more than 32,000 drug instructions. Then we do the extracting work. We firstly extract drug's effective ingredient term to construct a drug's effective ingredient term lib for recognizing the effective ingredient in text written in natural language. For tuple D, which includes DN, EC, DA, we can easily extract to construct a term lib capital EC, which includes EC subscript 1 till EC subscript M. Because many drugs contain the same effective ingredient and some drug introductions show they consist of more than two effective ingredients, and we cannot distinguish which ingredient participates in response of pharmacodynamic described in DA. So we extract 2,747 kinds of effective ingredient from more than 18,000 tuples. Then we do the grouping work. For drug introduction DI, each sentence as subscript I in DIA is segmented and tokened by ICTC layer system. Because of the specification of sentence as subscript I, we group all these sentences with draw weka. By grouping, we summarize 43 kinds of drug ingredient interaction by analyzing the grouping result. All these types are coded. These types can be used as the edge of network as a template to generate medical report. And the following chart gives the proportion of each drug reaction types. So for each sentence as subscript I in DA, we generate a tuple ADR which includes EC subscript I, EC subscript J, and TK. In tuple ADR, EC subscript I is the EC attribute of DI and ECI is recognized from sentence as I. And then we utilize this information to construct ingredient-to-ingredient level drug-ingredient interactional network. To describe the relations among effective ingredients, we defined a directed network DIN. Each effective ingredient ECI in capital EC is regarded as a node V in network DIN. So EC can be regarded as the node set VE in DIN. For each ADR is converted to an edge E in which ECI is the tail and EC subscript J is the head. T subscript K in ADR denotes the type of edge E. A matrix capital A is used to denote the network DIN. If there is a drug-ingredient interaction between load Vi and Vj, the element A subscript ij of the matrix A denotes the type Tk. If not, A subscript ij is equal to 0. And this picture shows the drug-ingredient interaction network, which includes more than 2,700 nodes and more than 11,000 edges. With complex network theory, we identify what kind of complex network the drug-ingredient interaction network is, and analyze some features of the network. Some important index to evaluate a network are graph density, degree distribution, average price length, and etc. With the algorithm here, we can find out the adverse drug reaction. And after all, we generate a medication report for users in an easy way. And that's all for my presentation. Thank you very much.